with less shakiness. Okay, we can have a more sturdier grip. Then make sure that we don't cause any damage or injury into your ear. Alright, so if you could give me your left ear, okay, just turn towards the left over there. I'm just gonna have a look. Okay, so first visualizing the external ear going into the ear canal. Okay, I do notice a buildup of cerumen, okay, on this ear, the left ear, which does occlude some landmarks. I'm going to do that same thing on the other ear, so I'm just going to tug on the pinna upwards. Alright, into the external ear, beautiful ears. Let's go into the ear, external ear meatus, and look for that tympanic membrane. It should be pearly gray. Okay, alright, let me pull this out. How did that feel for you? Alright, is it difficult to hear? I understand. Okay, let's try it. Let's try it with a bigger. Sometimes size matters when it comes to medical exams. Alright, let's try with a bigger tuning fork. Ooh. How does it sound? You can hear that, both ears. Alright, let's try again with the Weber test. Placing it. Ooh, okay. This kind of feels nice. Alright, the vibration feels nice. Alright, put it on your head. We can place the tip of it so that we can kind of view what's going on. It's kind of like a little telescope, but except for the ear. That auditory meatus, or this canal, is eventually going to lead us to this structure called the tympanic membrane. You might have heard of it. It is sometimes called the eardrum. It's called the eardrum because just like a drum, it is a thin layer of tissue that separates the external ear from the middle ear. How it works is just like a drum. It kind of bounces. If you ever hit on a drum, it'll start to vibrate and resonate, and eventually that gets transmitted into what we know as sound. That information is converted later on in the inner ear by the cranial nerve number 8, the acoustic nerve, into what we interpret to be sound. Just like as right now you can hear my voice. Can you hear it on this ear? And on this ear? Why, hello there. Welcome to the clinic. How are you doing today? That's good to hear. I understand you're coming here for an ear examination. Right. Before we begin, could you just remind me of your name and date of birth? Okay, perfect. And can you tell me about what's going on with your hearing? Is it your hearing? Okay. All right. Sounds good. So it sounds like you're having some experiences with hearing high-pitched sounds out of the blue. Okay. All right. All right. So before we continue on our examination, I'm going to explain to you what's going to happen. Okay. So first, I'm going to explain to you the procedure, what we're going to do. I usually like to educate my patients about their own bodies. So I'll give a little brief overview of the anatomy and the physiology of the ear. And then after that, I'm going to ask some more questions to better understand your hearing problem. And then after that, we're going to take a look into the ear and see what's really happening. And lastly, we're going to go over some common conditions that could happen with the ears and what we can do about it. How does that sound? Sounds good? Okay, let's begin. Before we begin, I'm just going to make sure that I sanitize my hands, okay? Put this clipboard away. Alright. Just make sure that everything is sanitized before we begin. Okay. I'm really happy that you came into here today. And at any time of this exam, if you feel uncomfortable, please let me know. You always have the right to stop the exam at any time you wish, so just let me know. Each and every time before I do the procedure, I'm going to explain it and ask for consent. Alright, sounds good. Okay, so let's begin. So first, it sounds like what you're telling me is you're having ringing in the ears. Is that correct? Alright, okay. So before we begin, I just want to show you how the ear works, okay? We have this nice handy dandy anatomy flashcard, which is really nice, but I like to show you on a bigger diagram in my textbook over here. Alright, let's get our textbook over here, our handy dandy mermaid pen. Alright, so the anatomy of the ear, so I'm not sure if you can see this, but here we go. How does that look? Good? Okay, so the ear is divided into three parts, okay? We got the external, what you see on the outside, the middle, which is right here. So the external, the middle, what you see right here, there are three prominent bones there, which we'll go over in a bit, and then the internal, right over here, which is largely responsible for hearing, okay? So what you see on the outside, and what I could see on my ophthalmoscope, my tool, which I'm going to show you later, is this part. We have the pinna, or sometimes it's called an auricle. It's really neat, this anatomy. I can show you on myself, because you'll notice its shape, okay? Its shape is kind of like an amphitheater, right? If you've ever watched a Shakespeare play or been to Rome, and you'll notice this design, or you've attended an opera or some sort of a concert. It's designed to capture sound, and it's designed to capture sound and funnel it into the ear, and that's the external part. And the external part is made out of cartilaginous tissue, okay? And the interesting thing about the ear, the external part, is that it never stops growing, which is why you may notice that in older individuals, their ears are actually, it seems a little too large for their face, and that's because, you know, their head stops growing at a certain age, but the ear continues to grow. Just a fun fact. So oftentimes when I do my examination, I'll have a look at the external ear and feel around to see if there's any pain. Sometimes pulling on the ear can cause pain, which can be indicative of certain ear conditions, such as infection. Okay, so inside the ear, you can take a look at someone else's ear. It's hard to see on your own, but with my otoscope, which is something like this, I'll be able to look within the ear. Okay, we can place the tip of it so that we can kind of view what's going on. It's kind of like a little telescope, but except for the ear. And that auditory meatus, or this canal, is eventually going to lead us to this structure called the tympanic membrane. The tympanic membrane, you might have heard of it, is sometimes called the eardrum. Okay, it's called the eardrum because just like a drum, it is a thin layer of tissue that separates the external ear from the middle ear. How it works is just like a drum. It kind of bounces. If you ever hit on a drum, it'll start to vibrate and resonate, and eventually that gets transmitted into what we know as sound. That information is converted later on in the inner ear by the cranial nerve number 8, the acoustic nerve, into what we interpret to be sound. Just like as right now you can hear my voice. Can you hear it on this ear? And on this ear? You can hear the sound. Do you hear a difference between both ears? We'll continue later on with the examination. Okay, so that's the external ear part. Okay, it goes into. If you'll notice this, this is a temporal. This is a temporal bone. It's part of your skull, so it goes in pretty deep, and eventually we are met with the tympanic membrane or the eardrum. From there, I can take a look at some structures which will reveal whether or not the eardrum is healthy. Sometimes through infection, it can get perforated, or through pressure. If you've ever ridden in a plane and the altitude changes, or you go to a mountain with a different elevation, or you go diving under the sea, the pressure change you can feel it. Sometimes your ear will pop. Sometimes it is too much. It can actually rupture the eardrum. Okay, so from there we have the middle ear, which consists of 3 bones. Okay, the stapes, the malleus, the incus, and the stapes. Right, the malleus, which means hammer, because it kind of looks like a hammer. Incus is called incus because it's kind of shaped like an anvil, right? Like in the olden days when they forge a sword or of some sort, they'll use the hammer and the anvil to kind of shape whatever it is that they're trying to form. If you're a fan of Mandalorian, like me, there's a lot of scenes of forging the Beskar, kind of like that. Okay, and next is the stapes, because it kind of looks like stirrups. If you've ever seen those saddles that goes on top of the horse, or if you've ever been horseback riding, that's kind of what it resembles. So that's why they're named malleus, incus, and stapes, or in common terms, the hammer, the anvil, and the stirrups. From the middle ear, it kind of branches out into what is called the eustachian tube. The eustachian tube connects to the oropharynx, which becomes really relevant when it comes to talking about certain infections that we can get. Sometimes when we get a cold or something that affects our nose, throat, it can also affect our ear. We'll talk about that later. And of course, we have the inner ear, where we have the cochlea, the snail-like structure, and then the vestibule and the semicircular canal. And then you can see here cranial nerve number 8, which then connects there, which helps us determine sound. And the way we determine sound is through what is called air conduction or bone conduction. Air conduction, as the name says, is vibrations that we detect from the outside through air, and it goes in, it gets interpreted by the cranial nerve number 8. And bone conduction, which you'll get to experience later, is the vibration that we interpret through the vibration of our skull. As we speak right now, our voices are determined by the shape of our skull and how those vibrations vibrate within our skull cavities, and it's determined by this cranial nerve number 8, which is why you'll notice that your voice may change when you have a cold. That's because your sinuses, which we have here, frontal, facial, the zygomatic and ethmoid sinuses, they can get filled up with mucus, and when that gets filled up, you sound nasally, right? Because now there's no more space for sound to resonate. So that's just a fun fact about the ear. Do you have any questions about the ear anatomy and the physiology? So anatomy being the structure, and physiology is how we hear. So when the tympanic membrane vibrates, also these 3 bones, the malleus, incus, and stapes vibrate, and then that information is detected by the cranial nerve 8, which then we receive the signal in our brains to interpret it as sound. The other thing that I haven't mentioned that's really cool about the ear is that it's not only responsible for hearing, but it's also responsible for our balance. So sometimes if you feel dizzy, that could have something to do with the hearing, because the inner ear, especially the semicircular canal, they are responsible for interpreting the sound and sending the information to our cerebellum at the back of our brain, which determines our positioning in our space. So if there's something going on in the ear, in that sense, we could feel dizzy, we could lose balance, and we can get injured if we fall. So that's why it's important to have your periodic ear checkup every now and then. So thank you for being here. So let me put this away, and then we can go ahead with the examination. So before we continue, do you have any questions? Nothing? Okay, sounds good, because if you have any questions, you can always type it in the comments below and I'll see if I can answer it. Moving forward to our second part of the exam, it's going to require me to obtain some more information, okay? So that way we can further investigate what's happening with this ringing in your ear, okay? Alright, sounds good. So let me just get my pen here. Perfect, and our handy dandy clipboard. Alright, so the first question that I want to ask is, tell me about what's happening with your ear. Okay. So it sounds like you're experiencing ringing in the ears, is that right? Okay. Can you tell me when you started hearing it? And can you tell me which ear is affected? Is it one ear or both ears? Okay. How long does it last when you experience this ringing in your ears? And when there's this ringing in the ears, do you notice any other symptoms? Like dizziness? Okay. And how often does it happen? Let's say in a month's time. And can you describe to me the sound characteristics? So when we interpret sound, it's often determined by a wave, okay? So sounds that are more, they happen in more frequency. That's kind of like the frequency of the sound, so it'll be more higher pitch. So we kind of describe it as the amplitude or the loudness, or the frequency and the pitch. Is it a high pitch, like E, or low, middle, like E, or low, E? So a high pitch. Okay, so it's a very high pitch. Okay, is there anything that makes it worse? So it sounds like when you're tired and stressed out, it's worse. When you've been on the computer all day, it's worse. Okay? When you haven't slept well, it's worse. Okay? I'm so sorry to hear that. So understanding the causes of our symptoms helps us fix the symptoms, because if we can fix or eliminate the cause, then we don't have to worry about the symptoms later on. Okay, good. Is there anything that makes it better? So rest, okay? Sleep. A hot bath. Sounds lovely. Perfect. Thank you so much. Okay, I'm just going to gather some more information regarding your health history. Okay? Have you had any ear infections in the past? Any ear infections in the past? When you were a kid? Huh. You used to swim a lot. Okay. That's quite common. Otitis externa, or swimmer's ear, is a very common phenomenon to happens to people who are submerged in water. Water gets into their ear and causes infection. I have a dog who's a Labrador retriever, and he loves the water, so he often gets these kind of ear infections from time to time. Any discharge, meaning any kind of fluids that you notice coming out of your ear. Sometimes this fluid could be serous or clear. They could be purulent, which is kind of like a yellowish pus. Or sometimes they can be sanguineous, which is red, indicating that there's blood. So if there's been any injury in the ear, that could be the type of drainage. Discharge. So no discharge as of now. Okay, but you do have noticed a buildup of earwax. Okay, we'll have a look. Have you noticed any hearing loss in any of your ear? Any hearing loss in any of your ear? Okay. Oh, I see. So you've noticed there's a diminished hearing. Okay. You listen to loud music when you were a kid. I see. I remember when the iPod first came out, we had like MP3 players back then, and believe it or not, listening with earphones is actually a lot more hazardous than listening to just regular loud music. And that's because unfortunately when the ear sets are designed, they're designed to funnel sound right into the ear, so you're getting a more concentrated version of that sound as you would otherwise if you had to pick it up from the outside. So over time, listening to loud music with earphones, or listening to loud music in general, or being in loud environments, whether it's a part of your work and you're operating machineries, or you're living next to a highway or an airport like myself, it can over time degrade your ears, because in our ears, okay, there are little hair cells called cilia, and this cilia vibrate when there is sound, and over time, if they're exposed to loud sounds, those muscles and those cilia, they can harden, making it harder for them to vibrate, thus making it difficult for us to hear. So it's very important to be attentive about the sounds that are around our environment. And I know as ASMR viewers, you have very, very keen hearing. You have probably some of the most keenest, most acute hearing of any other type of human being. I say humans because animals, a lot of them have even more evolved and developed hearing than us. Okay. Perfect. Yeah, which leads us to the next question that I have is environmental noise. How often are you exposed to environmental noise? Okay, whether it's cars or just loud machinery, loud music. Okay. So notice I mentioned earlier that the ears are also responsible for our balance. So have you had any experiences of dizziness lately? Okay. So dizziness or vertigo could be an indication of any dysfunction that's happening within the labyrinth of the inner ear. Okay, so when you're experiencing this periodic dizziness, do you feel like you're spinning in the room or the room is spinning around you? It's a question I ask because that determines whether it's what is called clinically true vertigo, which is when the room is spinning. Yeah, and certain conditions we can look at later on called Meniere's disease, whether it's due to the varying pressure in the ear, or there are some stones in our ear called otoliths, and sometimes when those stones get dislodged and they roll around, it can affect our balance and can make us feel dizzy. So there are certain medical maneuvers of rotating the head called the Epley's maneuver, which fixes that symptom 9 out of 10 times. So it could be a simple fix as that, not needing any medications. So it sounds like you're having ringing in the ears, which is commonly called tinnitus. Okay, and this is not a diagnosis. It's just what it's called, tinnitus. It's ringing in the ears, and it can happen on both sides. Sometimes on one side, sometimes the other. And it sounds like you hear it more when the environment is really quiet, and when you're stressed out more, and when you haven't slept more. And often, every now and then, you also feel dizzy. Okay. Is there anything else you'd like to add? Alright. One thing I have to ask you about is your self-care practices with your hygiene with the ear. And there's nothing to be ashamed about, because actually a lot of problems can be caused by people cleaning their ears. So there are these often Q-tips. I'll show you right over here. Alright, so a Q-tip, commonly used to clean the ear. So this can sometimes cause problems when you insert it too deep, and then it causes an occlusion because you, or I am guilty of this, always cleaning my ears with Q-tips, have pushed the cerumen or earwax inside the ear. And it also kind of depends on the quality of earwax that you have. Just like I mentioned, there's different qualities and colors and textures of discharge. With cerumen, because our ear is kind of like a semi-apocrine gland. An apocrine gland is anything that is a gland that secretes kind of like a thick, sweaty sweat. So we have thin sweat, okay, secreted by the eccrine glands, and the apocrine glands secrete the more kind of muskier, smelly sweat that we find in the armpits and the genital area. There's some speculations about how we communicate before with scents. A lot of animals and mammals, often they will put their scent and mark certain areas. Certainly your cat and your dog would do this. Certain animals communicate by pheromones. So there's some assumption that through evolution we might have communicated with these apocrine glands. So these modified apocrine glands in our ear, they secrete cerumen, and they do that to protect the ear. Okay, so it creates this kind of waxy material. If you've ever seen Shrek, there's kind of a scene where he pulls out a wax candle and then lights it. That's to the extreme. However, it is meant to kind of protect the ear from any kind of invasive particles or even insects that could come in there. Creates a very inhospitable environment for bacterial growth, because then there's there's a microbiome, and if it's healthy, it protects us from certain germs that can proliferate, causing problems and ear infections. So in a sense, the cerumen or earwax is a very healthy physiological function of your ear. Okay. So that concludes our subjective investigation, or our interview. Next, we're going to move into the fun part, which is the physical examinations. Before I continue, are you okay? Is there anything that you need right now? Maybe a glass of water? Okay. Alright, so we're good to go? Okay. So before we continue, because I touched the clipboard and my pen and such, I'm going to sanitize my hands one more time, and then I'm going to don on some gloves, sanitize one more time, and then sanitize the equipment. Is that okay with you? Alright, good. Okay, so I'm just going to do that right now. Take the sanitizer, and while I'm sanitizing my hand, I'm going to briefly explain to you how the physical examination will go. So in any physical examination, there's usually 4 components. The first is inspection, which I'm just visualizing your ear, taking a look at how they look like from the outside, and then I'm going to go out and go in with my with my ophthalmoscope, and then visualize the internal structure. Okay, and then there is also the palpation, where I go with my hands and feel around, speaking of which, I'm going to wear my gloves. Okay, so I'm just kind of pressing lightly around, noticing if there's going to be any tender points around the pinna and the structure around, and usually that'll give us information about the health of your ears. Gloves on. Okay, so after the palpation, in some exams we're required to do a percussion, where we tap on our finger to kind of assess the structures within a cavity, such as in internal organs. But in this case, we won't be able to do that because we we can percuss on the skull, but it's not going to give us much information unless there's nothing in there, which then we'd be able to hear some sounds, but for the most part, this is a part that we don't need to do. Okay, and lastly, we're going to, so inspection. Oh, and auscultation we're not going to do. We could auscultate the temporal arteries just to make sure that there's no major arteritis that could happen. So that's something that could be possible. Okay, but let's go ahead and sanitize my gloves because I'm going to be placing my hands on you, so I want to make sure that everything is sanitized. I'm also going to sanitize our equipment. Just get rid of these disinfectants. Alright, so I'm going to introduce you to our tools. As always, we have our handy dandy stethoscope, although this will play a minor role in our examination because, as I said, we're only going to require it for the auscultation of a potential temporal arteritis, and this is usually done if there's severe headache, which I didn't capture in your subjective findings. But nonetheless, if you want it done, sure, I can have it listen into the temporal artery. Okay. Next, we have our handy dandy otoscope, which is really cool because this part can switch off. This portion can come off, and we can put in an ophthalmoscope. So to take a look into the eyes. But for today, we're going to keep it on to take a look into the ears. So give her a good sanitizing. Alright, okay. The other pieces of equipment we have are these tuning fork. Okay, this is a 512 hertz tuning fork, which is standard. Okay. Sometimes I have a difficulty obtaining a sound from there, so I sometimes use this larger one, a 128C tuning fork. I like the sound of it when I hear it. This is really cool. Place it on one ear. And next. Alright, let's hold our horses. Okay, let's go step by step. Okay, so I've sanitized my equipment. I'll put this pen back into the pocket. Sanitize the pen as well. Off we go. Alright, so step one is done. We've sanitized everything. So now we can go ahead with our examination. Okay, first is inspection, as I said. Okay, we can take a look at the temporal part, if there's any kind of irregular pulsations that could indicate, as I said, temporal arteritis, which is what I don't see. Just looking at the general symmetry of your facial features, which are really beautiful, by the way. So you have really nice, beautiful facial features. Could you give me a smile, please? Like so. Perfect. And I'm just looking for symmetry here. Sometimes with certain conditions like cerebral palsy or any kind of conditions that affect the nerves. So we have the facial nerves. We have a lot of nerves going on in this area. Can lead to either paralysis or an asymmetry, but I don't see any of that, so that's good. Okay, the next thing, I'm just gonna, if you just turn, okay, I'm just gonna take your head and I'm just gonna take a look into your ears to make sure that the alignment, okay, is where we would expect them. So yeah, both ears are aligned in the position. Okay, I'm looking at the pinna. I don't see any kind of lesions that I should be concerned about. Also looking at the mastoid process here, there's no redness. Sometimes mastoiditis can be a result, can be an indication of an internal ear infection, which is not the case here. Okay, alright, so while I've finished my inspection, I'm just gonna feel around if that's okay. So I'm just gonna feel around your head area here and your temporal side, the mastoid. I'm gonna pull on the pinna, okay, or the auricle. I'm just gonna pull upwards and downwards. So I'm just gonna demonstrate you on me how it looks like. So I'm just kind of feeling like so, okay, and I'm feeling right here, okay, and then right here. So that's what I'm doing right now. All right. You feel any pain or tenderness when I tug on this ear? Or when I tug on this ear? Nothing? Okay, good. All right, fantastic. Okay, so I think we've passed the inspection phase. All right, before we continue with the otoscope, I do, as I said, want to listen with my stethoscope through that temporal artery, just to make you feel good that that's can be ruled out, because that's a very significant red flag. So what I'm going to do is I'm going to listen with my bell of the stethoscope. That's what we use to hear low pitch sounds. Low pitch sounds, just like this voice right now is low pitch. Okay. Alright. So there we go. So I'm just going to have a listen. Okay. And on the other side. Alright. I didn't hear anything abnormal there, just regular pulsation sounds, but nothing too extreme, no bruise, certainly. Okay, so we can put that stethoscope away. Alright, so before we continue, so I always work with the least invasive procedures before moving on to the more invasive ones. And really, putting an instrument into the ear can be invasive, because that's, you're entrusting someone to place a foreign object inside your body, which can be really intimidating. So we'll save that for last, okay? But before we continue, we're going to do a hearing test, okay? How this works is going to whisper to one ear like so, and whisper in the other one, and what you have to do is repeat the words. I'm going to ask you to press on this part, which is called the tragus, as I whisper. So for example, like so. So I'm going to be pressing, okay, and I'm going to be pressing, and I'm going to press on your tragus, okay? So you hear that? So I'm going to press, and I'm going to whisper, usually a two-word syllable, like 99. You can just repeat that. And then same thing on the other one. Blue moon. Okay, let's try again. 99. Perfect. Blue moon. Alright, some other words. Baseball. Soccer. Subscribe to Hiraya ASMR. Like. Comment. And share this video. Helps a lot. Thank you so much. You're perfect. You're wonderful. And I'm so grateful for you. Thank you so much for continuously tuning in to my channel. Perfect. Okay, so what did you hear? Alright, I hope you do it. Sounds good? Okay. Alright, so next, let's take one of these tuning forks, okay? Just again, let's see if we can obtain a sound. Ooh, okay, how does that sound? Alright, do you hear that? So we're gonna first begin our examination with the, I can't remember, is it a Riney or a Weber? One of them. I believe it's the Weber test first. Okay, I could get this opposite, but it's just a name, who cares? So let's get through the Weber test. I'm going to demonstrate on myself first, okay? So I strike the tuning fork. Alright, you hear that? I'm going to place it on my head. Like so. Can you see this? Alright. And what you should hear is equal lateralization on both ears, okay? So equal lateralization on both ears. What does that mean? it means that I should be hearing both of them on both ears. And here we're testing for the sensory neural hearing loss. Remember, I said that sound can be detected through air conduction or bone conduction. Well, we're placing this tuning fork directly onto our head, and it's capturing the sound through vibrations through our bones, our skull, and that's giving us information. So if you hear it better on one side than the other, usually that's indicative of conductive hearing loss on that side, when you hear it better on that side. Okay, when you hear it worse on one side, that's usually indicating sensory neural hearing loss. Sensory neural because it's the bone conduction is not able to travel, or your nerves, your acoustic nerve, cranial nerve number 8, is unable to interpret the sounds through bone. So you'll hear it worse on the worse side, you'll hear it better if there is conductive hearing loss or air conduction. We want to hear them both equally on both sides. Okay, so that's the Weber test. Okay, so I'm going to do that on you and let me know how you hear the sound. Okay, ready, set, go. Alright, is it difficult to hear? I understand. Okay, let's try it. Let's try it with a bigger. Sometimes size matters when it comes to medical exams. Alright, let's try with a bigger tuning fork. Ooh. How does it sound? You can hear that in both ears. Alright, let's try again with the Weber test. Placing it. Ooh, okay. This kind of feels nice. Alright, the vibration feels nice. Alright, put it on your head. Okay. One more time. One more time. Alright. Equal on both ears. Sounds good. What's that? It kind of sounds similar to your tinnitus, except it's louder. Yeah, because this is really high frequency, right? So sound can seem to be replicated. Put that one away for now. Okay. Oh, before we continue, almost forgot the Rhine, okay, or Rin, however you call it. So Rin, Rhine. I think it's Rin. Whoever said Rhine. Okay. Anyway, how it works? I'm gonna put it on this mastoid process right here. Okay. And then when I stop hearing the sound, I'll say, okay. Alright, so when you stop hearing it, say okay. I'm gonna place it to the ear. You should still hear it because air conduction should be, technically should, there's no shoulds, but what we normally see, or what we commonly see, is commonly hear, I should correct my terminologies here, what we commonly hear is that air conduction is twice as long as bone conduction. It means that you can hear it twice as long through air conduction, so when we pull it up you could still hear it, okay, but the same length of time as you heard it when we placed it through bone conduction through the mastoid process. Similarly, when we placed the tuning fork on top of the head, same idea that we're getting here, okay? And then when we stop hearing it, we say okay, and then we place it on the ear, and we should still be able to hear the sound, like so. Okay, why don't we try that on you? Okay, so you let me know, okay? Right over there. Alright. You let me know when. And now, okay. And now through air conduction. Perfect. Right through bone conduction. So, were you able to hear both of them? Any significant alterations on either one? Okay, they're both equal and bilateral. Okay, sounds good. Let's just, for fun, ring this again so you can hear on one ear like so, and then the other ear like so. Alright. Sounds good. Alright. Now we're going to move on to our otoscope. So we set the light. You can adjust the light over here. So I think that should be good. Alright, so I'm just going to shine this light. Okay, can you follow this light? Alright. Okay, follow the light. Perfect. Good. Have you ever had someone take a look at your ear before? Huh? Okay. Alright. So what I'm gonna do, we've sanitized the equipment. I'm gonna place a little covering onto the probe. It's for hygienic purposes. Because I use this tool on many people, even though we sanitize it, I want to make sure that we are using a disposable probe. Okay, so that probe, this disposable probe, is going to go in there. I can still see. And there we go. Now, we have the probe. Okay? Now, a lot of people take a look into the ear like so. Okay? Pointing it like a gun. I'm going to do the opposite. I'm going to point it like so. This way, I'm able to better control the handle and rest my arm onto your head. So there's less shakiness. Okay? We can have a more sturdier grip. Alright? So that make sure that we don't cause any damage or injury into your ear. Alright, so if you could give me your left ear, okay? Just turn towards the left over there. I'm just gonna have a look. Okay. Alright. I'm just taking a look at the structure here. So first, visualizing the external ear going into the ear canal. Okay, I do notice a buildup of cerumen. Okay, on this ear, the left ear, which does occlude some landmarks. There's bony landmarks on the tympanic membrane, such as the umbo of the malleus. I'm looking for the pars flaccida, pars tensa, also the cone of light reflex. Alright. Okay. I'm going to do that same thing on the other ear, so I'm just going to tug on the pinna upwards. Alright, I'm going to stabilize my equipment. Okay, look into the external ear, beautiful ears. Let's go into the ear, external ear meatus, and look for that tympanic membrane. It should be pearly gray, okay, with a cone of light. You'll find it on the right side at 5 o'clock and on the left side at 7 o'clock. Alright, looking for the bony landmarks, which I'll show you what it looks like just in a second. And pars flaccida, pars tensa. Sounds good. So just less cerumen buildup on this one. Okay. The other one is almost very hard to see because it's been kind of impacted. I see you tried to clean it up, but then it got pushed in more. Okay. That commonly happens, no problem. Alright, let me pull this out. How did that feel for you? Okay. It's not too bad, right? Not too bad. So here, let me show you what I'm doing here on our handy dandy textbook. Alright, so here's the textbook. We went in with the otoscope in such a way, right? So I could bring it into the internal ear canal, external ear canal, and right over here is the tympanic membrane. Here's what it looks like when I'm visualizing it, right? So turn this off. Say battery. Over here, what we're finding is a tympanic membrane, which is kind of pearly in color, pearly gray. Alright, here's the cone of light. You can see there's the pars flaccida. On the opposite is the pars tensa. There's the incus and the ambo. The incus being one of the bones in the middle here, right? And there's the posterior fold, the short process of the malleus, you can even see. So that's what we're looking for. When there's cerumen or earwax buildup, then it can be very hard to see that. Sometimes we can see a perforated eardrum, as I mentioned earlier, and through infection and stuff. And sometimes the doctors will actually go in there, puncture that eardrum and put a tube to kind of release the pressure. Alright, so just to have one more time, when we're looking into the ear canal, I inserted the otoscope in a upside down manner to stabilize it. Look into the inner external ear meatus over here to visualize that tympanic membrane, which looks like this, with its bony landmark, the umbo, the handle of the malleus, the short process of malleus, pars tensa and pars flaccida, with a cone of light visible at either 5 or 7 o'clock, depending on what ear you're looking at. Okay, alright, so any questions regarding your ear? It doesn't look like there's anything, but let's see if we can take care of that build-up cerumen on this left ear right here. Alright, so because you've already tried the Q-tip, I'm going to see if we can use this little scalpel, okay, and to go into the ear. Alright, so I'm going to need my otoscope here to visualize that one more time as an external light source, okay. So just going to go in one more time, stabilize it, okay, alright, and from there. Alright, so I'm just going to place that over here, and I'm going to see if we can get that ear. Alright, I'm just going to move really close in there and see if we can kind of... Alright, so it's kind of hardened a little bit, so why don't we put some... I have some organic castor oil here. And we're going to use this to kind of extract that ear, so let's see. I'm just going to take this eardropper, okay? And we're just going to squeeze some oil into your ear right there, okay? Just to kind of soften it. Alright. Okay, while we do that, we're going to just do it on the other ear as well, just to prevent any kind of dryness. Okay, alright, so just putting some organic castor oil into your ear. Is that okay with you? Alright, sounds good. Alright, just gonna let it settle for a bit, okay? And next I'm going to take this syringe and we're going to perform a lavage. We're just kind of like washing it out with some normal saline that I have right over here. Okay. See if we can kind of use the pressure of the fluid to soften and to kind of start to break down that debris that's kind of trapped into your ear. Okay. Alright, so I'm just going to go ahead and here again with this. Is that okay with you? If there's any discomfort, please let me know and I can stop the procedure. Alright, so here we go. I'm just going to go in there. Okay, perfect. The other one here. I'm gonna just go into your ear right here and just do the same thing. Sounds good. Okay, everything is looking good right there. Now let's see if we can go with a little scalpel. Go with a little scalpel and see if we can kind of extract some of that cerumen out of your ear so you can hear a little bit better. Alright. So I've done my best to extract as many as I could. I'm going to leave some in there because it's healthy for you, as I said. But I hope you're starting to hear a little bit better. Okay. All right. And as for the tinnitus, okay, the best way to deal with this is, as you know already, get some adequate rest. Try not to overwork yourself too much. Avoid excessive use of listening to loud music, okay? And just be mindful about your environment. Give yourself a chance to take a break from now and then. Be kind to yourself. You totally deserve it. Thank you again for watching and staying with me. Alright, so for the vertigo and dizziness, as I mentioned, there's a Epley's maneuver where we kind of rotate the head from lying down. That condition is called Meniere's disease. That's when the otoliths get dislodged. You can try that maneuver, so I'm just going to hold on to your head if you just lay down. Okay, I'm just going to capture your head with my hand here. Okay, I'm going to rotate it 90 degrees and 30 and lift up. Okay, same thing on the other side. Alright, how are you feeling? No dizziness so far? Okay, good. Sounds good. Sometimes when we have uneven pressure in the ear, that can cause some issues. It's just kind of like normal motions like chewing, swallowing can normalize the pressure in the ear. Okay? To prevent infections into the ear, I actually recommend not cleaning it as often because, as I said, those microbiome is there to protect our ear. Okay, just be careful when you're swimming. Alright, you can wear earplugs to prevent water from coming in to the ear. Alright, so yeah, otitis media can cause certainly the mastitis. Certain infants, especially when breastfeeding, bottle feeding, laying down, the fluids can travel up to their eustachian tubes and create an inner ear infection. That can be a common problem because the eustachian tube is not as deep as when you grow up to adults. That's why we actually pull the pinna downwards for young children, because their ear shape is not as kind of like deep or as an adult. So it's kind of, the ear canal is kind of in that shape, so that they're more susceptible to ear infections. Yeah. All right. So yeah. Again, inserting kind of foreign bodies into the ear can kind of put the risk for rupturing the tympanic membrane. So just be careful when you're cleaning your ears with a Q-tip. Okay. And some people are just more prone to excessive cerumen. Some people have dry cerumen, which is kind of like flaky. That also kind of depends on people's genetics. Some people have kind of more of a more wet cerumen, and that's kind of like what I saw here, which is why it was impacted. So every now and then it would need a lavage, cleaning, but you can always come back to the office to have that done. Okay. And as for the tinnitus, like it's really, medically it's called idiopathic, meaning we don't really know what causes it. But it sounds like, in your case, it coincides with levels of stress and lack of sleep. So if you are able to take care of yourself, hopefully some of those symptoms will go away. Okay. Some people it can progress to kind of very severe where people aren't able to sleep and can be really uncomfortable. So it's very important to take care of that tinnitus. Yeah. Sometimes just kind of like changing the pressure in your ear by shifting the jaw left to right, you can kind of like mitigate some of those symptoms. Okay, some vitamin B deficiencies have also been kind of like linked to tinnitus as well, so make sure you're getting enough nutrients in your body, that you're eating well, you're sleeping well. Okay. Alright, so before we conclude this session, is there any questions that you may have for me? Okay. Alright. Well, it's really been a pleasure having you in our clinic. Thank you again for coming in today, and I'm gonna see you in the next video. Thanks again. If you haven't done so, if you could give this video a thumbs up, a like, and if you could comment on how it went for you, what sort of videos would you like me to do next, I really appreciate that. Thank you so much and have a good night.